And so, without further ado, we're going to jump right in. We've got uh, Dane Christiansen and Noah Davis-Logan here to present to us today, and also Kira Flaherty. And so, they're going to be telling us all about how to tell our stories effectively for advocacy work. A couple of things, as you just heard. The session is being recorded so that it can be posted for viewing later. Also, everybody's lines are muted. I will be able to allow folks to talk during the Q&A session, so don't feel like your voice is stifled on the other end. You will be able to chime in. Um, Also, questions as they come up during the presentation, please put them in the Q&A uh, box at the bottom or in the chat. And as already said, this will be available later because we're recording it. So I'm going to hand it off to Dane.
Thank you very much. For those of you who don't know me, my name is Dane Christiansen. I'm managing partner at the Health and Medicine Council. I've had the pleasure of working with Accessia for many years. I'm joined by my colleague, Kira Flaherty, who also does Washington representation work. We talk for a living. We talk on Capitol Hill every day, but we're going to talk about how you tell your story effectively. And in that regard, we're very lucky to have a headliner with us, Noah Davis-Logan from the U.S. Hereditary Angioedema Association. You will notice as you hear from Noah that he's very dynamic. He's very good at explaining how to tell your story and how to be an effective advocate. I've seen him do this before in action, so we're very lucky to have him with us. And I also want to point out that, unlike myself, Noah is very young. So this isn't a skill that you might need years to develop or constant practice. It's something that you can learn and engage with rather readily. And we're going to give you some of those best tips and tricks. But I do want to point out that what we're talking about is making your voice heard and that your voice has real power and can really, you can be a great advocate for yourself. And there are different ways that you can do this. Of course, people say be your own advocate all the time. One of these is just normally on your healthcare journey. People say be your best advocate with your doctor. Learn about what's going on. Stay up on medical research. Stay informed and have a good discussion. Don't just be kind of fobbed off or feel like you're not getting the attention you deserve or not having your questions answered. Advocate for yourself. If there's something you want to know or if there's a new treatment that you've heard about, bring it up. And the other one, of course, is with third-party payers, which I know Accessia is probably very familiar with and can be an advocate with you, of course, and help you with that journey. But I think everybody knows the experience with this community as well. You get a prior authorization notice, you get a claim denial letter. A lot of this just occurs as a matter of course. The insurance companies and others know, well, you just send out these kind of blanket notices, and then most people are never even going to think about it or they're not going to fight it. You have every right to stand up for yourself. Figure out what's going on with your coverage. Use great resources like Accessia and others to help navigate that process, know what you're entitled to, and be an advocate with third party payers. Only, pay your fair share or what you're supposed to. Don't have anyone telling you what your coverage should be or what your access should be. And don't let anyone disrupt you and your doctor deciding a treatment plan. So there are many ways to be your own advocate. But we're primarily today going to talk about how to be effective with elected officials. And there's really two ways that you can make your voice heard with elected officials. One of them is coming up very soon in November. That's by voting. This is not a public process, but anyone can weigh in by voting with what they think should happen or the overall direction of the country. That's a political maneuver, though. You also have the ability, a constitutionally protected right, to engage with your senators and representatives. They are there to listen to you, to take input, and this is not a political process. This is a policy-making process. You are an expert resource for them. They need to know your experience. They have different people coming in, drug and device manufacturers, insurance companies, and everyone is saying how the healthcare system should be or how it should work. They want to hear from you because you are their constituent. They represent you and they want to know where the opportunities and gaps are. Is everything working how it should, or is it not? What are the challenges you face? Be honest, share your story, be direct, share truthful and anecdotal information. And that is how you can help inform this process and give them the information they need. They're going to be making decisions on healthcare with your input or without it. It's much better that if they're making decisions that affect you, they do that with your input. Now, that's not a technical process. What we're going to talk about is how we do that in the most effective way. And that's by sharing our journey and telling our personal story. Next slide, please. Sorry, definitely wasn't trying to advance those on my own. So, just to remind everybody how we got here and how this works from an advocacy perspective. First of all, thank you for being willing to share your voice. Thank you for being willing to do this. It matters. Of course, there's plenty of folks with rare, chronic, and complex diseases that can't tell their story. So, in some ways, we advocate for them as well. If you are going into your senator's or representative's office or having a virtual meeting and you're telling them what your experiences are, you are also speaking on behalf of others who couldn't make that meeting work or can't share their story. So you can even be doubly effective. But what we're doing and how this all works is, of course, it may not seem like it all the time, but the system of government today is very similar to the system of government that was set up 250 years ago. We have three separate co-equal branches. We have a White House and an administration, which is also federal agencies like Medicare and Medicaid Services, the Department of Veterans Affairs, the National Institutes of Health, which does medical research. We have another branch of government, which is the courts. The courts are the Supreme Court, your local courts, and they're calling balls and strikes. Who is in their lane? Who's doing what they shouldn't? That doesn't just mean criminal stuff. That means things like if the White House says, well, we're going to make a new policy, the courts would say, well, can you make a new policy, or is this the role of Congress? Is this the role of senators and representatives? The executive branch is meant to enforce the laws. The courts are meant to interpret the laws, and your senators and representatives are meant to make the laws. And they do that by listening to you, not to the president or anybody else. This is a part representative democracy. You give them the information they need to make good decisions. Party and all that stuff matters much less than them knowing you, knowing your story, and knowing what you're asking for. You can politicize and PR almost anything. Your story, what you need, and in a private conversation, can very easily convey the information that can help make policy even on a national level. But remember, your senators and representatives have a few key authorities. They have the power of the purse constitutionally. They decide how much money gets spent and where it gets spent. Does it get spent on medical research? Does it get spent on public health? And does it get spent on things like Crohn's disease or cancer or interstitial cystitis? That's a powerful tool. They have oversight of federal agencies. Is NIH doing what it's supposed to? Is the CDC doing what it's supposed to? Congress has the ability to weigh in on all that. And and decide what else they should be doing or if they're doing things effectively. And they can make new laws. A common example is Medicare and Medicaid and coverage in general. Medicare and Medicaid is very draconian. And science and medicine move forward very quickly. So oftentimes, what's covered and how it's covered lags behind what science allows. So it doesn't just mean, oh, we have a new product, so now it's covered in a new way, or a new diagnostic test and it's covered in a new way. There's a whole bureaucratic system that has to catch up to that. So Congress often needs to adjust the laws or tell the agencies, you're covering this new genetic test or you're covering this new at-home infusion. They have to do that. But of course, if you're experiencing that gap in the meantime, they might not be aware that that's a problem unless you tell them. But there are good ways to do that, and there are good ways to share your story. I will mention, next slide, please, particularly as a rare disease patient, you have an important role to play because, of course, when the community is smaller, there are just fewer people who can go in and share their story, but they have the same type of need for medical research and public health and patient care as anyone else. So if you do have a rare condition, educating and providing what your experience has been to avoid a one-size-fits-all solution from Congress, something that's more bespoke to your needs, is very important. And I'll mention really quickly what advocacy is not. It's not political. If your member of Congress is Republican, just for example, whether or not you're a member of a Republican Party or how you voted or what your other ideas are about free trade or oil or anything else is irrelevant. You're there to talk about healthcare. You're there to talk with the healthcare staffer who's a policy expert. And it doesn't, you do not have to try points of the day or things you see in the news cycle. You are there to talk about your experience, what's happening for you locally, how the healthcare system is or is not working for you. It's not political, it's not politics, it's policy making, it's educational. And you're not lobbying. Advocacy is different than lobbying. You sharing your story is a constitutionally protected right. It's very different from what Kira and I do as professional advocates on Capitol Hill. I have a right to speak as an individual citizen as well. I can talk about issues that I care about, but the professional capacity is different. And the one reason why I mention this, I think people often have I know public speaking doesn't come naturally to everybody. Some folks, it's very daunting. Sharing your story can be a little nerve-wracking. There's a lot of misperceptions from TV that this might be something like a courtroom where you're getting asked questions and you have to respond to them, or there's a dais and people want to know things, or you're having to make a presentation or convince people of your argument. Not the case. You are not there to necessarily get them to commit to do something in the moment or try to come up with the most eloquent argument to convince them. You are there to be honest and direct and to share your story and answer questions in a truthful way. And by doing that, you will allow them to change the system to make sure it's working better for you because that's their job as to how to change that to work for you. So the conversations are often very narrow, just one person or a couple in the room. It's a much more intimate and private discussion, and anything you say is meant to be kept private as well. I think that's important. Next slide, please. So, successful advocates. Kira, do you want to take over here?
I certainly can. Thanks, Dane. Hi, everyone. My name is Kira Flaherty. As Dane noted earlier, I work closely with Dane at the Health and Medicine Council. I'm a senior legislative consultant there, and I'm also a Washington representative for Accessia Health, so helping to manage their Hill Day and get everyone ready for that currently. So successful advocates. Yes, it's a great photo from our previous Hill Day. Always nice to have matching t-shirts. I think it's a nice touch. But successful advocates are ones that really focus on educating. I think when it comes to healthcare, when it comes to health policy issues, I think the argument is just in the facts. It's in the situation. You describe your circumstances as a patient. You describe your barriers. You just describe your lived experience, and it's clear what needs to be done. A lot of times there are a lot of barriers and things that prevent access that don't really make sense and aren't very patient focused. So by you educating and providing your experience, congressional offices are able to take that experience and look really closely, okay, what can I do from a legislative perspective to provide some fixes here? And without you, a lot of member offices wouldn't be aware of what these situations are happening, how they are happening in their local districts, in their states. So as Dane has already noted, you as an advocate, you as a patient advocate or a caregiver or a family member, you are the expert in the room and you are the one providing that information that allows the member, the staff of that member to then go do the work and provide maybe a new piece of legislation, maybe just a resolution, or maybe some report language in a new appropriations bill. In addition to, advocating through meeting with congressional offices, a lot of successful advocates make other local connections. They're typically very active in their communities. So uplifting and empowering community organizations, that can be really effective in getting those community organizations to also reach out to their members to advocate for something. I think when members are hearing from multiple different parties from the local area, from the state, that can be really powerful and helping to advance your priorities. And it really is about knowing when the time is right to make your asks. So we are very specific in what we recommend when you should be coming to the Hill. So typically the best times to come to the Hill to advocate on the federal side are in the spring and in the fall. And this is because Congress tends to be in session and they are very close to working on things like appropriations bills or potentially advancing healthcare legislative packages. So early in the spring, we do some advocacy, and Accessia Health was able to do some virtual advocacy then. But that's a great time to engage members because the appropriations bills for the following fiscal year are typically in construction. They are in the early days of that construction. So it's very helpful to meet with your members and provide your insights, your priorities, saying, hey, this is what we really need to see included in next year's bill. In the fall, it's another great time to meet with members because they are towards the final process of finalizing those appropriations bills. So we typically call this conference period, where the House and Senate are coming together and basically determining what is going to be in the final piece of legislation that passes, what is being funded. So it's another great time to reiterate your priorities and make sure they are being included in whatever passes the finish line. Additionally, in a year like this, we have heard a lot about an end of year healthcare package. That healthcare package will likely include a lot of patient focused legislation. So this is another way to amplify our priorities and say, hey, if there's going to be a healthcare package, the Safe Step Act, the Help Co-Pays Act, these important pieces of legislation should absolutely be included there. So I think advocates not only are good at educating, but they are good at staying informed themselves and knowing when the time is right to engage their legislators and reach out to them. Next slide. So when you're in these congressional meetings, they don't necessarily have to take place coming to Capitol Hill. We absolutely love that. Dane and I really love taking folks to the Hill and providing those stories, but it doesn't have to happen there. We know that that's not a feasible option for everyone. So it absolutely can take place virtually, right in the format that we're in right now, over Zoom, over Teams. It can be a phone call to the office. It could even be as simple as an email to the office as well. And then Dane and I have all those contacts for the health staffers in every single congressional office. And so you can absolutely have your voice heard in not just meeting and coming to Washington. You can do it in so many different ways in this digital world that we are in now. And then you can also do local visits. So every single congressional office has local offices. They have the DC office, but then they have regional offices. They have offices throughout the state. So you can go and to the local office yourself, set up a meeting there, or just chat with the staff there. But when you're meeting on Capitol Hill, or you set up a virtual meeting or maybe a local visit, they typically are about 30-minute meetings that you are expected to meet with the staff. You may be able to have the member join you, but it's not as often. Typically, you're meeting with staff and the member may come say hello and stay for about 5 minutes or so. Sometimes they stay a little longer, but we tend to be on the Hill during the busy time, so it's rare that you can get a member there for longer than 5 minutes. But when you're sitting there with staff are really the ones doing the work. They're the eyes and the ears of the Congress member, so it's absolutely valuable to spend that time with a staff member. But even though the meetings are scheduled for about 30 minutes, we tell folks to think of it as you have 15 to 20 minutes with the staffer. And within that time, you want to have time for open dialogue and question and answer. You don't want to take the full 15 to 20 minutes telling your story, sharing your lived experience, and even more so if you have multiple folks that are in your group that are meeting with the office, you want to allow for everyone to share their story if they're all constituents of that office in particular. So we always recommend your story being about more like 2 to 5 minutes, and one that can be, shaved down if it needs to be, or one that allows for questions and room for expansion if the staff or the member has questions that you can elaborate on later. I think one point here, focus on a single issue area. I think that's really effective, particularly if you are in a group where maybe you have 3 priority areas and you have 4 folks in your group. Maybe you have one person whose story really speaks to one of these priority areas, and the other folks in your group have different stories, different experiences that speak to the other priorities. I think that's a really organized and effective way to approach these congressional meetings. But I think it's also, say, if it's just you meeting with the office and you want to touch on all the issue areas, you absolutely can. And even if your story doesn't necessarily touch on all the components there, it's still effective to share your story and to also speak to the other priority areas. And you may be able to speak to maybe other lived experiences you've heard through being a part of the organization, through being around other patient advocates. You can also share those examples as well. So every single congressional meeting, typically the run of show starts with a round of introduction. So you would introduce yourself, everyone in the group would introduce themselves, the staffer would also typically introduce themselves. So that elevator pitch is what I was referring to. You want that 2 to 5 minute is even a bit long if we're thinking elevator pitch, but you having a 1 to 2 minute version of your story is effective as well. Sometimes you walk into these congressional offices or you have a virtual meeting scheduled and it ends up being a lot shorter. Say the staffer is 10 minutes late. So now you only have 10 minutes with them. That means you really do want to shorten your story and basically be able to give the highlights, give the key impact points, and then allow for some questions and answers with the short time that you do have. You may also be running late to meetings if you're on a full Hill day that we tend to schedule for our members. That we do, or for our organizations, we put a lot of meetings in one schedule, and we always recommend giving yourself time to make it to the next meeting. But say if you're in a meeting where a staffer has a lot of questions and you end up sitting there a little longer, you may also be running late. So keeping track of time and knowing where you're at is definitely an important thing when you're in these congressional meetings, knowing how much time you really have. And you just want to be honest, really. So honest in telling your story, honest in telling your experience. And also, if a staffer asks a question that you don't know the answer of, that is totally fine. You can say, you know what, that's a really good question. I don't have an answer for you today, but I'd be happy to follow up. A lot of times staffers will have really technical questions about data points or things that you just may not have off the top of your head, that you may not have looked up before prior to your meeting. And that's something that is a great use of follow-up later. So we always say when you're meeting with congressional offices, make sure you get the contact information of the staff you're meeting with. If it's in person, that can be the form of a business card. If you're calling or emailing, just making sure that you have the correct phone number or email address to be able to send that follow-up note. And so we always recommend having a brief set of asks prepared. And that can also be included in your follow-up. So yes, you'll make those asks in the actual meeting, but the effective follow-up is reiterating those asks so it's clear. Your asks may have several bill numbers, for example. So if you're verbally saying all of those in the meeting, it can be hard for the staffer to get it all right if they're taking notes. Some staffers may not take any written notes at all and just rely completely on the materials and information that you provide in follow-up or leave behind. Next slide. And so outcomes from advocacy, there can be some really great outcomes from advocacy. One is just increased investment. The slide here says increased investment in federal medical research, but it doesn't just have to be medical research. It could be health workforce. It could be pathway programs to get disadvantaged and underrepresented students into the healthcare workforce to go and practice in those healthcare shortage areas. It can result in new dedicated public health and patient care activities. So Congress is able to establish new programs, new lines of funding, or establish awareness months, awareness weeks that focus on public health and patient care. And how they're able to do that is through meeting with the organizations, meeting with the patient advocates who are telling them, hey, this would be really great if you could do this. And then they get the information from us and they're able to have those formal actions and spread that awareness, spread that education, and really create impact there. It can also impact ongoing development and approval of new treatments. So, FDA is a federally regulated organization. So Congress has power in directing FDA and what they should do. And so I noted report language earlier. Report language is something that's included in every single appropriations bill every year. Report language can directly provide action or directives to specific agencies and what they want you to do. So Congress can put in, hey, you really need to focus on these disease areas. You need to find different treatment pathways. You need to focus on working on addressing the barriers to care for these specific disease areas. So through your advocacy, something like that could also be created where you get better treatments, better access, or quicker approval processes. And also, if you're dealing with a situation personally, locally, say out-of-pocket costs that are just too much that you can't handle, or you're being wrongfully treated by an insurance company or a medical provider or anything, that's something that your congressional member can also help with. They can engage, they can write letters, they can get on the phone, they can do stuff to help you. As Dane noted, they work for you. So if you have your own issues, your own things that you could really use a helpful hand, they are there and they want to hear that and they want to know how they can be helpful. So, don't hold back in these meetings. Really just be honest, be truthful, and your experience really tells it all. And it's something that these member offices really remember. Dane and I being the policy folks, we can go in and say, hey, these are really important policies, but that's not the meaningful part. It's the meaningful part is the patient advocate saying, hey, I lived through this. This is what I experienced, and this is why it's important. So I think I am now turning it over to Noah. So next slide.
All right, thank you. And hello, everyone. My name, once again, is Noah Davis-Logan. I'm 22 years old and a fresh LaSalle University alum, as well as a new hire for the U.S. HAEA. I'm honored to be here to speak about how I share my story with HAE and my journey with the Hereditary Angioedema Association. Hereditary angioedema, or better known as HAE, is a rare autosomal dominant condition that causes intermittent swelling in your extremities, your intestinal wall, and your throat, which is potentially fatal. 3 generations of my family also do have HAE, but I personally was diagnosed with HAE at the age of 3. And while growing up with this condition, it was very difficult. I had tons of stomach swells, which came with nausea, vomiting, diarrhea, and led to me spending a lot of time in the hospital. But I also experienced attacks in my hands, face, and I even had a life-threatening swell in my throat. And it was hard growing up and not knowing how to put words to this experience, especially when I was younger and always having this very hyper personality, if you all can't tell, where I always wanted to do so much and just be active, but there were times where I couldn't. Times where I couldn't go to friends' houses or play sports or go to school. And meanwhile, my mother was searching for therapy, but there were no treatments approved for the use in pediatrics at this time. So I was prescribed androgens with hopes of preventing the attacks. And while on the androgens, I still had attacks very frequently. And I continued using them until the age of 6, where I had a severe reaction. I was hospitalized for 3 months due to encephalopathy, meningitis, and 6 nerve palsy. And I went from a kid with no development issues to having to learn how to walk and talk again. And people thought I would never be able to get back to normal. But even throughout all the negativity, I still persevered because of my faith, support system, and doctors went above and beyond. And after that experience, my life with HAE was drastically different. I was placed on medication, and having access to medication, now I'm able to live my life beyond my condition. I went from missing a lot of days in school to being very active, and I loved college. There, I was involved in many clubs, including being in student government, RA, and being the president of my own powerlifting club. And you can tell, but advocacy has always been important in my life in many different stages. And it's at the age of 9 in which I gave my first speech at the National HAEA conference in Orlando. And it was here where I found love with advocacy and really saw its impact. And this opportunity introduced me to other patients and truly a family within the association, which I'm truly thankful for. And because of the people I've met through the HAEA, I've been able to not just accept my condition, but to walk in it. And the HAEA is a place where you can be both empowered and empowering. And as a result, I continue to be more involved in the HAEA and really buy into advocacy. And I've given speeches at colleges, sports events, conferences, and even internationally. And I always saw that there's potential in it. I see the power and impact in doing so. And I was genuinely impressed to see that there's real career development within this act. And to the degree that I now work with the HAEA as a contractor on advocacy and engagement. And in terms of sharing my story, I really prioritize 3 things, or 4 things actually. And these are intention, structure, context, and efficiency. And within the context, I've really said this thing about knowing your audience and intention. So first, I sort of recognize my purpose and think about understanding the context of who I'm speaking to, why, what I'm looking to accomplish. And this establishes a foundation. So I'm very intentional about which parts of my story I'm actually going to share and achieve the purpose of. And next, in structure, I make a plan where there's a clear beginning and end. So this is clearly communicated so that the audience, one, stays engaged, but also every part of my story is clearly purpose-driven. And I present the problem through that and follow up with how it's relevant in my story. So really seeing how my story fits in one revealing the problem, but also the solution. So after, I illustrate the solution and a call to action, which is important for follow-ups and also making sure that resolution is followed up with. And I believe within that, the most important thing to remember is that it's not right or wrong. It is your lived experience, and you truly are the subject matter expert of your story. And throughout it all, I think the most important thing and what I'm working on now is efficiency, making sure to stay concise and to really get the most from a very unique opportunity. So, especially when it comes to speaking with legislators, making sure to figure out how to be as impactful as possible and also be aware of the situation, the audience, and being able to pivot if needed. Within legislative visits, things do always happen. You mentioned being late in terms of the staffer or your own end. So, just making sure you're able to adjust when needed and make sure you leave time for questions because it really is about making the deepest connection and setting these expectations throughout your answers and responses so that's one, a meaningful relationship, but also a meaningful visit. And if you can go to the next slide, please. Well, we have them in reverse. I describe my experience as well, but I believe the next one it should be advice for some tips that I give. Here we go. And then we had the three-step plan that I went through. And these are sort of what I think about in terms of how I tell others. Oh, went right past me, sorry. If I can get the next slide, that's what I'm talking about. There we go. And this is about some tips that I give people to sharing their story and to practice telling your story right now. So I had this laid out in sort of a progression. It's important to keep in mind this is all confined to your experience. Your story is really important. So I think we all know it, and that the most important thing is to be prepared. And when it comes to preparation, preparation truly does make perfect in terms of understanding what you want to share and where it fits best. And then within that, I think that next is to make sure that we understand our audience and the context and to make sure that we're really drawing people in. So when it comes to actually sharing your story, you want to make sure that you keep everything relevant and that your story pertains to your mission and why you're there. And most often in the next step, if people are already listening, they're already invested and they care about what you have to say. So especially when we're in legislative offices, this is very important to know, even if you're a constituent or if you're there for the meeting, that what you have to say does matter. So you want to make sure that you're speaking with purpose as well and making sure every part of your story and the structure that supports it is related to the why. Because structure is really what holds the story together and makes it land. So within that, staying on task, keeping everything clear and concise helps that legislators can take something away from it. And lastly, and the most important, is to keep it simple and authentic. It is your story. It's a very unique moment. So it's important to make sure that if you want to have the most impact in this unique experience, that you share it. And I think it's an honor that everybody's here. And thank you all for allowing me to share. I know we have a portion for the Q&A. If anybody wants to announce that. There we go. I love questions, so please you shoot away.
Noah, thank you so much. I'll just, for the audience's benefit and anyone who's watching this later, I'll just mention a couple things that might help with your flowchart. When we say know your audience and we're talking about Capitol Hill, we mean a bunch of very young staff folks that probably do not have a background in medicine or science. So even though this person might be handling healthcare issues, there's a good chance they don't know an awful lot about the healthcare system. And there's a good chance they've never even heard of a condition like hereditary angioedema. So be very thorough with your explanation. Don't just assume that they have already know things or done research. And then just to give an example, going back to Kira's slide with the FDA for how telling our story matters. The FDA develops new treatments all the time. I think there's 11 FDA approved treatments for hereditary angioedema now, which is a testament to the community. But whenever FDA is evaluating treatments and Congress is overseeing them, they're looking at safety and efficacy. So the first time something gets approved, it skews that scale. You say, okay, now this product is available. Do we really need another one? Do we really need a new form of administration? And there's really two things that scientists at the FDA can look at whether your cholesterol goes down. They can look at whether your white cell count goes up. But what they can't look at is your satisfaction with current therapies. Is this working for you? Is it affordable? Does it have side effects? And also unmet needs, depression, pain, things that don't show up on an exam. Your story and your story to your members of Congress can help ensure that treatment development pipeline stays innovative and stays strong. And I do want to clarify one thing, though I think Noah did an excellent job bringing this home, but we talked an awful lot about your journey and your experiences. You do not necessarily have to be a patient or individually affected to be a good advocate. There's plenty of family members, there's plenty of friends that have been excellent advocates. One of the best meetings I ever had was with the hereditary angioedema community. And the person who was there was the neighbor. And they said, I'm here for my neighbor because I know my neighbor can't make the trip. And them explaining what they've seen their neighbor go through was a very important voice as well. So I hope this is helpful. We're here to be a resource. As Noah said, we're happy to answer any questions. And of course, we encourage anyone to practice that elevator pitch that Kira was talking about right now. How are you going to make it local? How are you going to draw them in? How are you going to land with your key points? Think about all of that. Thank you.
All right. Thank you all. That was fantastic presentation. And thank you, Noah, so much for sharing your personal journey, your personal story. You know, it's very close to you, and we appreciate you bringing that forth to us. I didn't see any questions yet, but for those of you who are in the audience, if you have any questions, please feel free to use the Q&A function in the toolbar or submit to the chat, and one of our panelists will answer them for you. I have one here from Aaron. I wouldn't know where to begin locally. You guys lead us so well over there. So where do you start if you're on your own advocating in your state?
So I'm happy to start answering that question. I'm sure Dane has some things to think about too. So it's very easy. If you know who your congressional members are, and even if you don't, there are websites where you can easily find who your congressional members are, where you simply put in your address. It tells you who your representative is. It tells you who your two senators are. And then you can just simply Google their name, or you may be prompted with a link to their website. So if you go to their website, at the very bottom, or it may be on a different tab, a different page, it'll say office locations. And then it'll show the local office location. So you would want to find the office that is closest to you, give them a call, and then you can either ask for a staff member's email address. If you want to email there, you can just, as you call them, say, hey, I'm interested in setting up a meeting or just providing some more information on my experience, and seeing what the office can do. So it's very simple and very easy to access simply by going to the member's website. Another way is Dane and I are also, we have access to the district coordinator or the constituent services person that is technically a DC staffer but has the connections to the local folks. So you can also go through us if, say, maybe you've been trying to get in touch with them on your end, haven't been successful. So, but I would definitely start by just checking out the member's website and giving a call to the local office, local number listed there. But Dane, I don't know if you have any other thoughts.
Anna was nice enough to link the Advocacy Action Center for Accessia, which can help you get connected as well. But I will just say there's a whole bunch of options that are right in your own backyard that you're probably unaware of. Your member of Congress probably has an office in the same shopping center where you get your groceries every week. And you would never know it's there. But if you go to the website, and if you're not coming to DC, if you look it up locally, that information is available. And those folks are equally willing to talk to you. And they provide a lot of services. You know, they can help navigating VA or TRICARE benefits. They can supplement work that Accessia might be doing with your coverage or access issues. But they are a tremendous resource. But there are numerous ways to connect with them locally. Usually house.gov and senate.gov is a good place to start to simply know who they are. But then the Advocacy Action Center that's linked is the next best option as well.
All right. We have one here from Jess Myers. Do you have any advice for first-time advocates?
I feel like that's a question for Noah.
I appreciate you to point at me. I was going to ask you one to answer first as well. But I think the most important advice that I would give for first-time advocates is that whether you're speaking to one person, 10, 100 people, you are changing the world. So I think not to downplay the importance in every opportunity in which you get to speak, and realizing that it really is an honor in terms of to share your story, but also just to advocate in general on behalf of someone else. And just to speak about the incredible power and impact that it has, because you really are changing lives and you are changing the world. So I just always want to inspire people and empower people to go out and advocate because it really is what moves the world.
And I think what folks are familiar with is, anytime if you watch any news program, they don't just simply recite facts or figures to you. They talk about somebody's story. Something like 60 Minutes does this very well, but there's a myriad examples. And I would just encourage anybody to think about those things that you've experienced that you found most compelling. Did it take you a long time to get diagnosed? Were you shocked after you were diagnosed to how limited the treatment options were? Were you surprised to find out there wasn't more medical research going on? Were you surprised at how your insurance coverage folks responded, or some of the hoops that you had to jump through, or prior authorization requirements? The things that you found most surprising would probably also be surprising to the congressional offices when you talk about innovation or research or affordability or any of these other contemporary issues.
We have another one in the Q&A. Can you help if we don't know what our situation is actually tied to from a legislative standpoint?
Yes. So I know we've talked an awful lot about some specific things, but most of the issues that the patient community is facing are broad. Some are very specific. The Hereditary Angioedema Association is pushing HAE treatment development forward, HAE research forward. But when it comes to patient care, you don't want to get painted with the same broad brush, but there are issues that are affecting everyone. They're not saying, well, HAE patients are being treated differently than pulmonary hypertension patients or anyone else. They're usually saying, okay, is it a rare, chronic, or complex condition? And then what are the hurdles? So if you've had to deal with prior authorizations, if you've had to deal with copay accumulators or maximizers, if you've had to deal with step therapy, if you've had to deal with challenges in the Medicaid program, whatever you're experiencing on your journey is probably very similar to what other patients with undiagnosed rare or chronic conditions are facing. The barriers to you getting care are in many respects the same. So it's even talking about that, the out-of-pocket cost issues, the ability to see a provider, the ability to have testing or preventative service covered. All of this is likely similar, and needs a voice.
And I'll just note, your lived experience is the local issue. So you don't need to know what the local issues are. If you are living in this area having this issue, that's the issue. So you don't need to know like, oh, this was in the paper, this relates to me, this bill is being constructed, this relates to me. You could just say, this is what's happening to me. This feels like it shouldn't be, and something needs to be done. And that is how things like the Safe Step Act, the Help Co-Pays Act, all these bills, that's where they came from. They came from stories where folks didn't have options. They had these barriers to care, and members said, we need to do something about this. And they created these bills. So while we do have a set of asks now because there was work prior, there's work already done on a lot of these issue areas. Just telling your story as is informative, and maybe it doesn't necessarily link to the asks we have, but it could result in a new ask. It could result in a new piece of legislation, or it could result in a tweak to one of these current legislations to make sure that your story and what you're dealing with is also addressed.
In the 1970s, late 70s, Congress passed the Orphan Drug Act and started rare disease treatment development. That came back to one family who said, I don't know why there just isn't anything going on in this space, and said this is unacceptable with their members of Congress, Henry Waxman in California, Orrin Hatch in Utah, and they fixed it. But that came back to that localized story of one family saying, why are there no treatments for my kid? And I would just point out, we just, as a genesis of the Orphan Drug Act, we recently, as a country, cured spinal muscular atrophy. If you can get it, it's very effective. It's new cutting edge medicine. It's also a very rare condition. So if you are a family with spinal muscular atrophy, you might be the only one in your congressional district. If you're not talking to your policymakers about your coverage problems, your access problems, the innovation issues, who else is going to be able to enlist their support?
I see the next question. What are the asks you have? Explain, please. So I think that for the purpose of this webinar, we're keeping it more general. I've said Help Co-Pays and Safe Step Act as examples because those are very popular in the patient care. They're both dealing with getting patients easier access to treatments that are effective for their specific diseases, or helping with copay accumulators and things like that. So we don't necessarily have a specific set of asks for this webinar in particular, but say if you are coming to Hill Day, we do have a set of asks there, and we provide a lot of prep materials. So anytime you're doing a Hill Day, or doing any type of visits on behalf of Accessia Health, Accessia Health makes sure that you are well prepared. They will make sure that you have a list of asks that have, the asks may include something like, please support this bill, and it provides the bill number. And then you explain in 2 to 3 sentences why that's important to support this bill. Another ask may be to say, provide funding to this agency. So provide funding to the National Institutes of Health in fiscal year 2027. Those are the types of asks that we typically have for each Hill Day. And I see that Anna actually put Accessia's Health policy priorities in the chat. So those are the exact asks that we'd be making on an Accessia Health congressional meeting.
Okay. Thank you so much for all of these answers. I see Anna shared in the chat Accessia Health policy priorities. You can find those on the website. And of course, if you have any questions, please feel free to reach out. If there are no other questions, which I don't see any popping up, I'd just like to thank our panelists one more time for this great information, for sharing experiences and knowledge with all of us. And for those of you who will be at Hill Day in just a few weeks, we look forward to seeing you there. Have a good afternoon, everybody.